Hi, everybody. Welcome to Dr. Nancy Live. We have a special guest today, all the way from Minnesota, right?
That's right. Yep.
Yeah. This is Dr. Strand. I met her at the autism conference in Georgia last year and was really impressed with what she had to say and wanted to bring her on to share her information with all of you regarding Lyme disease. And then as I've talked to her a little more, she has some other really neat things to share with us about what's going on in a lot of the families right now with the cold and flu season here. So, Dr. Strand, welcome.
Thank you.
Yeah, thanks. So tell us a little bit about your background and what you do.
Okay. So I'm a naturopathic doctor. I had a clinical practice here here in Duluth for about 10 years. And before I graduated, so 2005. So it's been 14 years. I can't believe that. I graduated. And now I took a full-time position with this company, Bio-Botanical Research, as their director of clinical education. And that really comes out of my confidence in the product line and what I've seen happen clinically. And I have a pretty deep desire to get this information out to the public and to practitioners so that they can understand the power of having this sort of tool in your toolkit, which we'll talk about what that tool is, right? But yeah, so that's my background and why I'm here.
Yeah, what impressed me with her is that she said she's up there in Lyme disease land, because a lot of ticks.
It's true. I pulled one off my dog's head this morning.
Oh my gosh! And didn't you guys have frost, don't you?
Yep, we do.
And it's still there?
Mm-hmm.
Oh, okay.
Yeah, it's really frustrating. And I came back from a conference. I walked my dogs. I have two dogs in the woods for an hour. The day before I left the conference, I came back and nobody else had noticed, but our Gordon setter had 3 engorged deer ticks on the top of his head, and our Labradoodle had one. So I took pictures of him and I put them up on a Lyme lecture that I gave at a conference a couple of weeks ago. But it's just so endemic. I mean, they're around, and those tick-borne illnesses are actually not even being called tick-borne illnesses anymore. They're being called vector-borne illness at this point, because what we're finding is that it's more than just ticks, that we're looking at, biting flies and potentially fleas where you can get potentially Borrelia, which causes Lyme disease, but also some of the other tick-borne illnesses as well. So it's around.
Yeah. Okay. Talk to us a little bit about that. What's going on when people are getting bit, and what's happening?
Okay. So ticks are just one, like I said, one vector. And typically, so this is my own take on, after doing my own testing, having my own practice, is that a lot of us have had exposure to these microorganisms. So Borrelia causes Lyme. There are a number of other that are tick-borne illnesses that can come alongside that. Bartonella, Babesia, Ehrlichia, Mycoplasma. There are a lot of them that a lot of us have had exposure to. And if we're living a healthy lifestyle, if we're eating healthy foods, if we're getting enough sleep, if we have healthy relationships, if we have a lot of us feel that spiritual grounding is an important part to that too. That if we're tending those things, that our bodies really are capable of staying on top of those microorganisms. It's when we get a trigger later. Oftentimes, it doesn't necessarily have to be at the moment of the infection, that we can succumb sort of to a more chronic condition with it. You can also get sort of the acute infection, and Dr. Cooper and I were talking about that before we went live, and I'll speak to that first, or now, I guess, which is that if you get transmission of a tick-borne illness, if you feel within a few weeks of a tick or a spider bite, something like that, that you feel like you may have the flu, it can be aching joints or aching anywhere in your body, fever, chills, headache. Basically, it just feels like you got the flu, right, for most people. And there can be what's called erythema migrans too, which is this bullseye rash. But that only happens 33% of the time. It is diagnostic for exposure to Borrelia. So if you get that, doctors don't even need to do testing to see whether or not you've got exposure to it. It means you've gotten it. So for all of you out there who've had a bullseye lesion and haven't had any treatment, chances are that either your immune system got on top of it, which is ideal, or that it's hanging out somewhere and waiting for the time to be right to sort of reveal itself. So I know it sounds kind of scary, and it
Yeah.
actually used to be really scary for me. And I think, sort of sadly, what happens is we end up being afraid to go into the woods and be out in nature. And one thing that I'm really grateful to this product line for is that I'm not afraid anymore to get, I don't freak out when my dogs, my kids, my patients get ticks. I feel like I have a really sound therapeutic to help prevent long-term illness and to help treat acute illness as well. So that was kind of a long diatribe, but is there anything else specifically about Lyme that you'd like me to speak to?
No, that was perfect. So what you're saying is that if they got a tick bite when they were a kid and they got really stressed out at work or something like that and were eating sugar and not sleeping, then that could actually come out then. So
Right.
it was latent for a while. Okay.
Yep. Often it can be a loss of a loved one. It can be, like you said, work stress, another illness. It can be, there are other things that can cause it as well, sort of trigger it. It's resurfacing. And with an acute infection, ideal is our immune system gets on top of it, or we take antibiotics, or we take an antimicrobial, which, of course, I'm biased. I think that's more ideal than, say, the antibiotics would be. And then it's resolved and there's no further effect. But there are sort of a couple of other things that can happen. One we just spoke to, which is that the bug, it becomes a persistent infection. And that can happen if we don't treat it, but it also can happen from use of antibiotics. So there's a woman, Dr. Eva Sappi, who's looked at testing in a test tube. So in vitro testing shows that when the spirochete, so the Lyme or Borrelia bacteria is shaped like a spirochete, and it takes different forms. So if it feels threatened, it becomes a persister form, which is the round body form. And it also can create biofilms, which we're going to talk about shortly. But when that happens, our body can't attack it. We can't attack and kill a round body form. And so if you take doxycycline, which is the standard of care for an acute tick bite, about 20% of those microorganisms become the persister form. So one cool thing about herbal medicines is that doesn't happen when you use an herbal. You don't get that it's called a pleomorphic shift, where it changes its shape and becomes the persister form. And these herbal antibiotics, basically, is how I think about them, also kill the persister forms. So you're getting a better sort of broad spectrum killing effect when you use the herbal instead of the pharmaceuticals. Okay. So that's another thing that can happen, right, is the persister infection. The other thing that can happen is, and I know this is going to sound a little scary as well, but just so that people understand what happens, is when you get an acute infection or even a chronic Borrelia or other tick-borne illness infection, it wreaks havoc on our immune system function. Causing inflammation, sometimes suppressing inflammation, and they're really doing that in order to. It's a way for them to survive, and they also utilize our nutrients. They can't produce the nutrients that they need to survive on their own, and so it basically skews our immune system, and it makes it so that we're inflamed. So it causes increases pain, and it causes the cytokine dysregulation. It's called inflammatory mediators, right? So when that happens, sort of one thing that these sort of natural therapeutics or herbals do is help with that particular issue, right? It helps restore immune system function, it helps calm down the immune system rather than just coming in and trying to kill the bacteria. It's more supportive of the body. So this is why I get so passionate about the use of this product. And maybe now is a good time to say that I think the liposomal Biocidin, which I pulled it out so you all could see it. Let's see if can you see it?
Yeah.
So this is the original formula, Biocidin. This I've used to treat Ehrlichia in my practice. So that's one of the tick-borne illnesses, because we didn't have this product yet when I used that. But this is what's called a liposomal form. And we have done some research with that product. And what we saw in that research is that the liposomal form, which is basically an envelope that allows the transmission of the herbal antimicrobial into the inside of the cell. So you don't have to work as hard. You don't have to take as high a dose. And it's also synergistic in our study with antibiotics, because it does help in other ways that are kind of complex chemistry. It helps disable some of the mechanisms that those microorganisms use to trick our immune system and to avoid being killed by antibiotics. But because of this ability to really get deep tissue penetration with a liposomal form, what I have seen in my practice and what the reports that we're getting from other practitioners is that it can be used both topically and then oral dosing, because you'll get directly from the mouth into the bloodstream, the lymphatics, potentially into the central nervous system and inside the cells that are infected in a way that we couldn't before. So this is the one that I have in my first aid kit, living in a tick endemic area. And it really, I think, what we have heard and what we see is that regardless of which bug is causing symptoms, it seems as though it really helps people acutely address symptoms.
Great.
And prevent long-term infection as well. That's been my clinical experience. It's not the company line.
Yeah.
So I'm not, we can't make any claims on it. I can just speak to my personal experience with the product in that way. So, that's sort of my, to my patients, that's always been my, here's what you need to have. And then as long as let's leave it at that for now.
Okay.
Let you kind of guide where you want me to go next here.
Yeah, you mentioned the biofilms. Why don't you kind of talk about that a little bit?
Okay. So biofilms are pretty recent in terms of discovery. Like 20 or so years ago, we started to realize that microorganisms create, basically, I like to call it like an invisibility cloak, where they can put something around themselves and over themselves. It's called the extracellular polymeric substance, EPS. And it's basically a slime that they put around themselves. So a lot of cells will develop what's called a flagella. It's like a little tail, helps them move towards each other. So a bacteria sitting by itself, free floating, will develop this little tail, and it uses that to swim to an area that it likes, right? So say it chooses a tooth. We'll use a tooth as an example, right? So we'll say a strep mutans microorganism. It finds a nice little dark spot in the tooth, and then it starts to reproduce, and it does this thing called quorum sensing, where they talk to all the other cells in the area, not just their own microorganisms, not just other strep mutans, but maybe they're talking to candida and they're talking to other fungal elements and other bacteria, and they decide when there's a certain tipping point that it would be worthwhile to develop this EPS, this slime, to cover them. And once they do that, then they can sit there, let the food come to them, whatever they're using to survive, and our immune system can't detect them. Antibiotics can't kill them. And sometimes it takes 5,000 times the antibiotic dose to get through a biofilm. And so this is a really big deal for reinfection, right? So it's one of the areas that is a cause for concern with antibiotic resistance. So, microorganisms, if they can resist it, they can become super infections, like MRSA and some of the other alarming C. diff and some of these other alarming superbugs that we're getting now. So that's it's pretty important to address this, right? Because we can have multiple pathogens behind a biofilm and infecting. And what I think is interesting is that, so we have a turnover of skin, sort of the skin on the inside of the mouth, all through the gut. The mucosa is what it's called, right? So the lining of the gut, all of that turns over. And so there aren't a lot of microorganisms that can actually establish and stay on tissue that turns over. But you think about the tissue that doesn't turn over as much, and that's primarily our teeth, right? And that's what plaque is. Plaque is a biofilm that's been produced typically by strep mutans and by candida, which is a chronic, it's a commensal, or it's a normal flora, but it can become pathogenic for people, right? So anyway, so I thought that was really interesting, and it's why prosthetics can become an issue. So if someone has a knee replacement, hip replacement, ear tubes, these are all areas where biofilms are more likely to become an issue. It's why oral health is so important. And we're understanding a lot more these days about the importance of oral health, because so for a number of reasons, right? It irritates the tissue in the surrounding area if you get it down in the periodontal area between the gums and the tooth. And then we can get displacement of the microorganisms into the bloodstream. Actually, after you floss, within 1 minute, we have systemic dissemination of the microorganisms in that area. So pretty interesting, right?
Yeah.
So it's really important, right? And you can create this sort of systemic, partly, I try to kind of consistently sit back into the fact that we're designed to deal with this, right? Just really the environment. And that's what you and I are talking about, how to manipulate that, right? And the way that we can do our part to support that is all those things we talked about before: good sleep, healthy relationships, healthy food, just a healthy lifestyle in general, will help your immune system, which is right there in your mouth. We have a ton of immune system function in the mouth. Stay on top of that stuff. There's so much interesting stuff to talk about.
Oh my gosh, yeah.
Too
So
on a tangent, but it's why Biobotanical Research has developed two dental or oral health products. So one of them is a toothpaste that has a Biocidin liquid in it that will help with that plaque formation. And then, I mean, that's the purpose of the product, is to help prevent the formation of plaque. And then we also have a rinse, an oral rinse that has the liposomal form in it. And then you'd be thinking, because of that liposome again and that better tissue penetration, you'd be thinking of things like root canals, periodontal disease, cavitations, that you'd be getting a deeper penetration in the mouth, and they can be used together. And the cool thing about it is your kids are already brushing their teeth.
yeah.
Your patients are already brushing their teeth. We're all already doing that. It's an easy way to start to improve the microbiome, so what's growing in the mouth, and create balance there. And there are studies showing that if you reduce the yeast growing in the mouth, that it dramatically reduces the yeast in the stool. So we know that. I love this piece of data. So there's 10 to the 8th microorganisms. So I don't know if that's billions of microorganisms in a milliliter of saliva, and we swallow a liter a day. So I where's my toothbrush? I need to go. I mean, it just makes it really clear how, and that's one of the things I love about the Biocidin liquid too, is that you start treating in the mouth, and you're treating all the way through the gut. So really effective GI therapeutics as well in treating all of that. And as you know, GI health is where it's at for a lot of the chronic illnesses that we see as well. So I'm sure you could tell I could go on and on about about day. But let me mention a few other things about biofilms, or make sure I didn't miss anything here. I maybe covered it, but I took a few notes. Oh, how do we get rid of biofilms, right?
Yeah.
So that's important. So Biocidin, so that's again the flagship product, which is this one in liquid, and the liposomal Biocidin. We've got studies for both of those products for disruption of biofilms. So on 4 different microorganisms for the liquid, and then on Borrelia, which is Lyme biofilm. They both, the liquid and the liposomal, were able to disrupt the Borrelia, and they also caused 97% cell death in 10 minutes in a test tube. The Biocidin did.
Wow.
So both of them did, and that's the study where we were able to see that also the liposome was able to cross the cell wall and get inside the cell. And I feel like that's kind of important. I left it out. Like, what is Biocidin? Biocidin is 17 herbs and essential oils. It's very gentle, easy to use in pediatric patients all the way through the lifespan. The only time it's contraindicated is if you have an allergy to something that's in it. Or pregnancy. We haven't tested it during pregnancy. So it's nice as a clinician, to be able to use it for something like thrush in a newborn, not have to go with nystatin or something higher intervention, all the way to frail elderly patients who've got catheters, and because of catheters not having that non-shedding surface, again, being able to assist them in treating biofilms. So it's something that you can really use across the lifespan as well. And because it's so many products that are synergistic, it's very well tolerated by most people, because it's not a high dose of any single herb that can be more abrasive to the system. I forgot to say that. So I do break down biofilms. The Biocidin works in a number of ways. It breaks down biofilms. It also is an antimicrobial, so it kills microorganisms, fungal, viral, yeast, bacteria. And then it also modifies the immune system. So we have studies showing an increase, upregulation in immune system markers with a single dose of the throat spray, which is Biocidin and alcohol together. So it's excellent. We use it in our household for prevention. So prophylactically, if one of us in the family starts to feel sort of scratchy throat, then all of us are on it immediately, right? To help prevent that coming down with the upper respiratory infection or, flu, any of those things. So that's this product.
So that's the
throat spray.
Okay, throat spray. Yeah. So you think in the medicine cabinet, they should have the liposomal and the throat spray, and probably be brushing their teeth with it.
Yes. And, and of course, I think the toothpaste, and you can imagine I've got these products all over my house. But it isn't, kids tend to like the flavor of the toothpaste as well. Yeah. So it's mint, and it looks like a gel. It's a little bit purple from the gentian that's in the Biocidin, so it's kind of cool looking.
Yeah.
But yeah, I think so. Prevent prophylactically, it's a very easy way to start treating the whole microbiome is by just using the toothpaste. And then using in fact, I had a chiropractor come up to our booth a couple of weeks ago and say, I ran out of my toothpaste and I got a cold. So it was, she thinks it was helping her keep from getting sick in the first place, which makes sense based on the study that we did. And that was a human clinical trial, which is kind of rare in our industry to get a human clinical trial on these products. So exciting to see. And then the other thing you might think about for cold and flu would be Olivirex, which is a high potency olive leaf. I don't have a bottle here, but that's a great very potent antiviral and great to get on top of if you start feeling like you're coming down with something.
So can you also do the Olivirex if people around you are getting sick too?
Yes.
Okay.
Yep, I use it the same way. 2 capsules 3 times a day is how I prescribed it in my practice, and how a lot of practitioners are using it prophylactically. And that's our max dosing. So if someone's acutely ill or has a tick exposure, we go pretty rapidly, the way the product is used by a lot of clinicians is to go rapidly to the max dosing, and then to use it for a short time until symptoms start to resolve. Until they resolve. Yeah.
Right. Yeah, I was telling you before we got on this live that I had a patient that got bit this summer by a tick, and we put her on liposomal, Olivirex, Biocidin, and she had the flu symptoms and all that you were talking about too after the tick bite. And she went to one of the local Lyme doctors here, and the Lyme doctor said that she wanted to know who put her on that, because she said she saved her, by doing that. So it was
great.
Yeah, it's
pat yourself on the back.
I know. I do. If I had never met you at the conference, I would have had no idea.
Oh, it's so exciting. It's why I get so excited about sharing this information, is so that as clinicians, the reason we go to school is because we want to help other people, either, and we're probably walking some sort of health journey ourselves oftentimes, right? But when we find a tool that's so effective like this one is, that can be used for so many different things, and it's so easy to use, it's just really rewarding, and it's really vital for us to have those tools in our toolkit to be, to make it easier and make our practice more effective as well.
Right. So. Now, you mentioned to me earlier about ear infections or otitis media.
So we've got reports from a number of clinicians using the liposomal Biocidin, because you get that better tissue penetration. So if you're trying to stay localized in the mouth and the gastrointestinal tract, then you would use just the liquid form. But if you're trying to get anywhere outside of the mouth, you want to use the liposomal form so that you get that better tissue penetration. So you could put, what we've got reports of is that you can have, you could do both oral dosing of the LSF, and then also reports of putting the LSF in the ear for just a drop of it in the ear to help treat otitis media.
Awesome. Great. Is there anything else that you wanted to share with everybody before we signed off today?
Well, as long as you're good, I'm good. I want to make sure. I think we covered the things that you and I talked about earlier.
Yeah. Yes. Lots of information. You can tell she knows her stuff.
I hope so.
I will put a link below our live as to where you can order the Biocidin products, and it's just something I've really I've been impressed by. I haven't seen out there, so I really wanted to get her on here to kind of talk about it, and I think you did a great job telling us about it. Thank you so much.
Yeah, thanks for the opportunity. I'm glad you're seeing results in your practice, and if we can be of further support, let us know.
Okay, great. Thank you so much.
Thank you, Dr. Cooper.